The global public health community is currently monitoring a highly unusual and deadly outbreak of hantavirus linked to a Dutch-flagged expedition cruise ship, the MV Hondius, which has prompted international concern regarding the rare potential for human-to-human transmission. The vessel, which departed from Ushuaia, Argentina, on April 1, 2026, was initially engaged in a transatlantic voyage with a route encompassing several remote and ecologically sensitive regions, including mainland Antarctica, South Georgia, and the South Atlantic islands of Tristan da Cunha and St. Helena. While hantavirus is traditionally associated with environmental exposure to rodent excreta, this specific cluster has drawn the attention of the World Health Organization and the Centers for Disease Control and Prevention due to the identification of the Andes virus strain. Unlike other hantaviruses, the Andes strain is the only variant documented to sustain person-to-person spread, particularly in confined settings like a maritime vessel. The timeline of the outbreak began shortly after departure when a 70-year-old Dutch male, hereafter referred to as the Index case, began exhibiting symptoms on April 6. Investigation into the Index case history reveals he had completed a 4-month road trip through endemic regions of Argentina, Chile, and Uruguay between late 2025 and April 2026. This extensive environmental exposure is currently viewed by epidemiologists as the most likely source of the initial infection. The Index case deteriorated rapidly, experiencing fever, headache, and gastrointestinal distress before dying on board on April 11. At the time of his death, the cause of illness was not confirmed, and the vessel continued its itinerary towards St. Helena. Why viewers and health officials are particularly concerned is the subsequent clustering of cases among those who had close contact with the initial patient. As of mid-May 2026, the outbreak has resulted in at least 9 confirmed infections and 3 deaths, reflecting a case fatality ratio of approximately 38%. The biological mechanism of the Andes virus involves a long incubation period, typically ranging from 1 to 8 weeks, which complicates surveillance efforts as individuals may remain asymptomatic while travelling across international borders. Early symptoms of hantavirus pulmonary syndrome, or HPS, often mimic common viral illnesses like influenza, featuring muscle aches, fatigue, and chills. However, the disease can progress with startling speed into a critical phase characterised by sudden respiratory distress, fluid accumulation in the lungs, and cardiovascular shock. In the context of the MV Hondius, the confined environment of a cruise ship, where nearly 150 passengers and crew from 23 different nationalities share common air supplies and facilities, presents a unique challenge for infection control. Reports from the vessel indicate a high level of distress among the remaining crew members, who have reportedly called for immediate and comprehensive disinfection of the ship's interior to prevent further spread. The situation underscores the logistical difficulties of managing a high-consequence pathogen in the middle of a transatlantic crossing, far from the specialized biocontainment facilities required for treating such a lethal respiratory virus. Core developments in the MV Hondius outbreak have accelerated as international health agencies coordinate the medical evacuation and laboratory testing of those affected. Following the death of the Index case, the vessel arrived at St. Helena on April 24, where approximately 30 passengers disembarked. Among them was the wife of the first victim, who was already symptomatic. Her condition worsened during a flight to Johannesburg, South Africa on April 25. She collapsed upon arrival at the emergency department and subsequently died on April 26. It was not until early May that laboratory results from South Africa's National Institute for Communicable Diseases confirmed the presence of hantavirus RNA in her system via polymerase chain reaction, or PCR, testing. This confirmation triggered a global health alert, as it provided the first clear evidence that the respiratory cluster on the ship was indeed a hantavirus outbreak. Simultaneous to these events, a third passenger, an adult male, was medically evacuated from Ascension Island to South Africa on April 27 in critical condition. He was admitted to an intensive care unit where subsequent metagenomic sequencing confirmed he was also infected with the Andes virus. By May 6, the World Health Organization received formal notification of the cluster under the international health regulations. The geographical distribution of cases has since expanded as passengers who disembarked in April returned to their home countries. Swiss authorities confirmed on May 6 that a male resident who had been on the ship was being treated in isolation in Zurich. Further evacuations occurred on May 7, when 2 air ambulances transported a 56-year-old British national, a 41-year-old Dutch national, and a 65-year-old German national to the Netherlands for specialised care at the Radboud University Medical Centre. One of these evacuated individuals was the ship's own medical doctor, a development that has significantly impacted the onboard capacity to manage the remaining population. The Dutch-flagged vessel was last reported heading toward the Canary Islands, Spain, where full disembarkation and quarantine protocols are planned. The response has seen the involvement of health ministries in Argentina, Chile, South Africa, the United Kingdom, and the Netherlands, as well as the European Centre for Disease Prevention and Control. Laboratory teams are currently focusing on genomic sequencing to determine if the virus has undergone any mutations that might increase its transmissibility between humans. While the current hypothesis remains that the outbreak was sparked by the index cases exposure in rural Argentina, the timing and spacing of subsequent cases strongly suggest a chain of transmission occurred within the ship's cabins or communal areas. Officials are contrasting the initial claims of a mystery illness with the verified molecular data, noting that the high containment requirements for Andes virus mean that only a few labs globally are equipped to handle the live virus for further study. The CDC has officially classified its response as a Level 3 emergency, the highest level of activation for an outbreak of this nature, reflecting the seriousness of a pathogen with a near 40% mortality rate circulating in a mobile, international population. Prevention and surveillance strategies are now the primary focus as the MV Hondius approaches European waters for final processing. Public health guidance issued by the CDC and the ECDC emphasises that while the risk to the general public remains extremely low, the management of those directly exposed is a high priority. Extensive contact tracing is underway for the 30 passengers who disembarked in St Helena, as well as for passengers on the commercial flight from St Helena to Johannesburg that carried a symptomatic patient. In the United States, the CDC is monitoring residents across 3 states who were part of the cruise, although no domestic cases have been confirmed to date. Some American passengers have been repatriated to high containment facilities, such as the Nebraska Biocontainment Unit and Emory University Hospital, to ensure they receive the highest level of care while preventing any potential secondary spread. Surveillance has also been extended to service personnel. Dutch officials reported that a flight attendant who had brief contact with an infected passenger was hospitalised for observation after developing potential symptoms. This highlights the precautionary principle being applied by agencies to contain the Andes virus. Regarding prevention, the standard guidance for hantavirus focuses on avoiding contact with rodent reservoirs, specifically the long-tailed pygmy rice rat found in South America. However, because this specific outbreak involves the Andes strain, the guidance has shifted toward clinical infection control, including the use of high-grade personal protective equipment for healthcare workers and the isolation of suspected cases in negative pressure rooms. For the general traveller, experts recommend avoiding areas with known rodent infestations and being cautious of aerosolizing dust in rural settings where rodents may nest. On the ship itself, the focus remains on rigorous disinfection of all surfaces and the ventilation system, as the virus can persist in the environment under certain conditions, though it is typically fragile outside a host. There are honest limits to current medical knowledge regarding this outbreak. Specifically, it is not yet fully understood how many individuals can be infected by a single case in a maritime environment. Nor is there a specific antiviral treatment or vaccine available for hantavirus. Care remains purely supportive, involving mechanical ventilation and fluid management in an intensive care setting. As the ship nears its destination in the Canary Islands, the international community remains on alert for any new symptomatic individuals appearing within the 42-day maximum incubation window. This event serves as a stark reminder of the complexities of global travel and the speed with which a localized zoonotic infection can become an international public health challenge. We will continue to monitor official statements from the WHO and local health departments as the situation stabilizes. For more updates on global health security, consider subscribing to this channel. The core developments of the MV Hondius outbreak represent a complex logistical and clinical challenge that has mobilized health agencies across 4 continents. Following the death of the Index case on April 11, the vessel continued its scheduled itinerary, arriving at the remote British Overseas Territory of St Helena on April 24. It was at this juncture that the scale of the crisis began to manifest as 30 passengers disembarked, including the wife of the first victim. Her subsequent journey created a significant international exposure risk. After boarding a commercial flight from St Helena to Johannesburg, South Africa, on April 25, she suffered a rapid clinical decline. Records indicate she collapsed shortly after arriving at a local emergency department and was pronounced dead on April 26. This secondary fatality prompted an immediate investigation by South Africa's National Institute for Communicable Diseases, or NICD. Using polymerase chain reaction testing and subsequent metagenomic sequencing, lab technicians identified the presence of hantavirus RNA. Crucially, the sequencing confirmed the pathogen as the Andes virus strain, the only known hantavirus capable of sustained person-to-person transmission. This blobatory confirmation transformed the situation from a localized maritime incident into a global health priority, as it validated concerns that the virus was spreading between individuals in the ship's confined environment. While the NICD processed these results, a third passenger, an adult male, was medically evacuated from Ascension Island on April 27. He was airlifted to a specialized intensive care unit in South Africa in critical condition, where he too tested positive for the virus. By May 6, the World Health Organization was formally notified of the cluster, triggering a Level 3 emergency response from the Centers for Disease Control and Prevention. The clinical focus then shifted to Europe as more passengers began to show symptoms upon their return home. Swiss health authorities confirmed that a resident of Zurich who had been aboard the ship was placed in strict isolation after testing positive. The situation reached a critical point for the ship's internal operations on May 7, when it was revealed that the vessel's own medical doctor had contracted the virus. This development severely compromised the onboard ability to provide care, leading to a high-stakes medical evacuation coordinated by the Dutch government. 2 specialized air ambulances were dispatched to transport the doctor and 2 other passengers, a British national and a German national, to the Radboud University Medical Center in the Netherlands, which houses high-level biocontainment facilities. In the United States, the CDC began monitoring several Americans who had been on the cruise, with some being directed to the Nebraska Biocontainment Unit and Emory University Hospital for observation. These facilities are among the few equipped to handle pathogens of this lethality, which currently shows a case fatality rate of 38%, based on the 9 confirmed infections and 3 deaths documented so far. Officials have had to contrast early reports of a mystery flu with the verified molecular data, noting that the long incubation period of the Andes virus, which can last up to 8 weeks, means that more cases may yet emerge among the 23 different nationalities represented on the passenger manifest. The Dutch-flagged MV Hondius is currently maintaining a course for the Canary Islands, Spain, under strict maritime quarantine protocols. Health officials there are preparing for a full disembarkation process that will require rigorous screening and the potential for long-term isolation of all remaining crew and passengers. The complexity of this response is further heightened by the lack of a specific antiviral treatment, leaving medical teams to rely entirely on aggressive supportive care, such as mechanical ventilation and extracorporeal membrane oxygenation, to keep patients alive during the acute respiratory phase of the illness. As the MV Hondius approaches the Canary Islands, the global public health strategy has shifted from immediate crisis management to long-term surveillance and the implementation of rigorous prevention protocols. The primary challenge for epidemiologists remains the extended incubation period of the Andes virus, which can span up to 6 weeks. This necessitates a strict 42-day monitoring window for every individual who was on board the vessel, as well as their primary contacts. Surveillance efforts are currently coordinated through the World Health Organization's Global Outbreak Alert and Response Network, ensuring that health departments in the 23 countries represented on the passenger manifest are operating with synchronized data. In the United States, the CDC is emphasizing a high index of suspicion for any traveler returning from the South Atlantic or endemic regions of South America who presents with sudden fever, severe muscle aches, and gastrointestinal symptoms, because the early stage of hantavirus pulmonary syndrome so closely resembles more common respiratory infections. Clinicians are being advised to prioritize travel history in their diagnostic assessments to avoid misdiagnosis during the critical early window for intervention. For those still on the vessel, the situation has prompted an urgent call for comprehensive environmental decontamination. The crew's appeal for professional disinfection highlights the specific risk posed by the Andes strain. While most hantaviruses are contracted through the inhalation of aerosolized rodent excreta, the documented potential for person-to-person spread via respiratory droplets or contaminated surfaces makes environmental hygiene critical in confined maritime spaces. Effective prevention on board requires the use of chlorine-based solutions or other high-level disinfectants capable of neutralizing enveloped viruses. Health officials recommend that any cleaning in potentially contaminated areas be conducted using N95 respirators, eye protection, and gloves to prevent accidental exposure during the scrubbing of surfaces or the maintenance of air filtration systems. In broader ecological terms, prevention centers on rodent exclusion and habitat management. Public health guidance for travelers in endemic regions such as Argentina and Chile remains steadfast. Avoid contact with the long-tailed pygmy rice rat. Keep food in rodent-proof containers. And never sweep or vacuum areas where rodent activity is suspected, as this can loft viral particles into the air. Instead, such areas should be thoroughly soaked with a bleach solution before removal. Despite these known strategies, there remain significant limits to current medical knowledge. There is currently no globally approved vaccine for the Andes virus, nor is there a specific antiviral drug proven to stop the replication of the virus once it has moved into the pulmonary phase. Medical intervention remains limited to intensive supportive care, which, while sophisticated in modern intensive care units, cannot always overcome the rapid progression of pulmonary edema and cardiovascular collapse characteristic of the disease. The ethical management of this outbreak requires a delicate balance between necessary quarantine measures and the transparent communication of risk to the public. International cooperation has been essential, as seen in the cross-border evacuations to the Netherlands and the sharing of genomic data from South African laboratories. As the 42-day surveillance period continues, health agencies remind the public that while the Andes virus is exceptionally lethal to the individual, its ability to cause a widespread pandemic is mitigated by its specific transmission requirements and the rapid response of global monitoring systems. The focus remains on containing this specific cluster and learning from the transmission dynamics observed on the MV Hondius to better prepare for future zoonotic spillover events. We will continue to monitor official reports from the Spanish Health Ministry as the disembarkation process begins. For more in-depth reporting on global health security, consider subscribing to this channel.